my members have great confidence in the NHS continuing, but it needs some TLC, some serious TLC, and we're very pleased to see the investment in staffing. But if you talk to both the public, and we've surveyed the public, and my members, they will say that we need two more things to happen. First, we need investment in social care, because that is a real block in moving people out of hospital and getting them in, looking after them when they've left so they don't go back in. And we also need investment in capital, because there are too many hospitals and too many mental health trusts and too many GP surgeries and too many other capital intensive services that need money, and all that is actually affecting the efficiency and effectiveness of the NHS. So at the moment we've got one leg of the stool. We're very, very grateful for the funding for staffing, but there's two other legs that need to be shored up and invested in.
Yeah, and you moved me on to the social care piece a little sooner than I wanted to, but I'm going to stick with the NHS.
Oh, sorry about that.
It's all right. I saw your tweet this morning, and I know that is a key element that you guys want to talk about, but you mentioned the workforce plan that came last week. That offers funding for 5 years. I mean, that's not good enough, is it?
Well, it's a start. I mean, right now, we went into the pandemic with 100,000, near as damn it 100,000 vacancies. We've now got over 120,000. It's not sustainable. We've been calling for a fully funded workforce plan for some time. I think NHS England have done a really good job in actually putting the workforce plan together, and we're grateful. At least the government's funding that. It's a long-term plan. It will require successive governments to invest, and it will also require a lot of hard work between my colleagues in the Confed, NHS England, in order to make it happen. But, we're grateful. We're just very clear that it's not enough in and of itself.
No, it's not enough. And look, both of your answers, you have mentioned the funding piece. I don't know if you saw the debate between Lord Winston and Dr. Gerarda earlier. There is a difference of opinion as to how the NHS should be funded long term. Where do you fall on what form of funding the NHS should need?
We're very clear, and I think the public are very clear in our surveys of them. They want the NHS to be free at the point of need, and they want the NHS to be funded through taxation. And at the end of the day, it's the NHS isn't free. We all pay for it through our tax. And it's the best insurance you can have, actually, because you've got 60 million people backing you. And other systems tend to lead to discrepancies and serious problems with people who are poorer or are sicker. And actually, we have a very efficient system, and we need to continue to commit to it. It's worth pointing out that for every £1 we spend on the NHS, we add £4 to the British economy. So this is about investment, and we need to think of it like that. There is no wealth without health.
No, absolutely not. But can it be augmented, is my point, Lord Adebowale. Can we add to it? Everyone wants it to remain free at the point of need, but it needs extra money. And those who perhaps can pay more, should they?
It does need to be invested in. I think there's a real question about that. We're already seeing people who can't afford private health care struggle to get health care because they don't want to be left on a 7.42 million waiting list. I think it gets very complicated when you start talking about additional funds. I mean, there are people who will choose to go private, but that's not the NHS that the people know and love, and we should continue to provide it free at the point of access and free at the point of need.
I'm running short of time. I just want to get your thoughts on social care. Do you think this government takes the social care reform needed seriously?
Well, we would hope they do. We've been certainly asking for proper funding for social care. It doesn't make sense, actually, to provide the funding for staffing and then not provide social care. Actually, 120,000 vacancies in the NHS. You've got 160,000 vacancies in social care. We need a plan for social care too. We've written to Number 10 and the Health Minister seeking that assurance that will come. It is deeply concerning that we haven't had the conversations that we need to have around social care. It is the missing piece, and most people in the public are starting to understand that without social care properly funded, we don't have a proper functioning health and social care system.